How you doing?
I'm good, thank you.
Okay. Last time you were here, you said 90% better, and that was
Mm-hmm.
2 days ago.
Definitely.
Progress incrementally daily.
Yes.
Okay. So 90% plus.
Yes.
Yeah. And then the projection is that one more time next week,
Mm-hmm.
and then
Maintenance.
yeah,
Yeah.
right. Okay. Maintenance entails this. What you notice is the tip of the iceberg. The acupuncture you've been getting was the master switch for you, which means is that regardless of what you came in for, well, you came in for the pain in the left upper back scapular area or the shoulder area, right? But let's say you had headache or hot flashes, or you fall down tomorrow, you have a sprained ankle, either right side or left side, still the same points work out for you, which means there's physiology underneath that tip of the iceberg. Then maintenance does make sense because it helps you to be more stable and help you to be more optimized where you are on your timeline.
Sounds good.
Yeah, logically makes sense, and
Right.
experientially, possibly so.
Yes.
Okay. All right. Then let's get started.
Okay, great.
Head there, legs up there.
All right.
All right. So your question is about you having hypothyroidism and see if something can be done for reversal of hypothyroid where it functions normally and you don't need medications eventually.
Correct.
Okay. How long have you been taking it for? Taking the medication
Well,
for?
I've been trying to remember 12 to 15 years.
Okay. All right. So then I'm going to say many different ways here, different things. I started doing acupuncture since year 2000. About 3 or 4 months into the opening up, I had a hypothyroid patient. She had hypothyroidism for 10 years. According to the MD, 2 to 3% working, and on palpation, multiple nodules. She took Chinese herbs, took it for a month. She felt good, and she stopped her medication. She still felt even better than before she was on medication, because even when a person is on medication, they may feel optimal or they may be optimal, but oftentimes they're not. So get them to an even better state, and so when they're either tapering down or not having, they're still doing better. Okay, even when there's a little dip, it's a little dip. Okay, and she took herbs for another 2 months. At the examination, almost no nodules. It was working fine. The doctor thought she was still taking medication. She didn't say anything about that. And then she came back about 5 years later because she was going through a lot of domestic stress. She took herbs for a month. Symptoms went away again. So same type of symptom came back. She came back 3 years later with similar symptoms, took herbs for several weeks, and she was still okay. Okay. Then over time, get to address whatever was not finished. What I prefer is for the person to take Chinese herbs for a month, and then in the second month, taper down a quarter each week. Then by the end of the second month, not taking anything. Third month, take the herbs continuously, maybe into fourth month, and then do a test. There's objective testing using natural medicine. That's called functional medicine. Okay. I don't do functional medicine because you already have a physician. What I do is get your feedback. What is your subjective experience before he has a set of symptoms? And what is it afterwards? And what is it as you progress? Symptoms related to the thyroid and symptoms related to your health and well-being. Health is less problem, better function. Well-being is more quality of you on a day-to-day basis. You're more focused, you have stamina, you feel integrated. Many things are working better. So you feel like you're more one, more unified. Okay. That's natural medicine. You could only use subjective symptoms to see how it is, because I shouldn't say you could only use. Because oftentimes what we're experiencing is subjective. Even pain is subjective.
Mm-hmm.
There's no device that measures how much pain you got. Okay, it's very subjective.
Mm-hmm.
So using objective and subjective makes sense. I mentioned about Chinese herbs. Yes, that's what's required. Plant nutrients to help you,
Mm-hmm.
not acupuncture.
Mm-hmm.
Top 3 applications in East Asian medicine are acupuncture, diet, and Chinese herbs.
Mm-hmm.
Okay, or herbal medicine or phytonutrients. You could use different words. Let's give a logic to what herbal medicine is. Okay, we'll do a comparison with food. Food is composed of fat, protein, carbs, and multivitamins.
Mm-hmm.
You have enough, good. You're nourished. If you don't have enough, you're malnourished. If you have a disease, you could take multivitamins every day. That's not going to reverse disease.
Mm-hmm.
What we're used to with biomolecular medicine is to take medication to take control of that molecular process.
Mm-hmm.
So it does things for you. The model is problem focused. If you don't know what the problem is, how are you going to treat it? It's like shooting in the dark.
Mm-hmm.
I remember celiac disease. Nobody knew what that was. With the gluten intolerance
Mm-hmm.
in the 70s and 80s, oh, well, maybe it's in your head. We don't know. Okay?
Mm-hmm.
Take something,
Mhm.
like psychotic medication, or do something.
Mm-hmm.
But we don't have a direct solution for you. And then patients were called back in when they discovered a correlation with the large intestine.
Mm-hmm.
So finding out what the issue is allows them to do an application.
Mm-hmm.
In natural medicine, it's not problem focused, it's person focused. We help you rather than help you for you.
Mm-hmm.
You have the genes, you have the wherewithal, you have the information to be able to go towards health and well-being.
Mm-hmm.
That means provide the right molecular environment to your genes and your cells, then there's an increased efficiency of giving information and regulating physiology. Therefore, you heal you.
Mm-hmm.
If it's stubborn and intractable and the model doesn't work, it's like, well, maybe it's your age. Maybe it's something we can't do anything about, or maybe we haven't found something yet.
Mm-hmm.
Okay. But what if there's already something else that's already there and have been tested and proven, but not with science? Science, golden standard of science is double blind, randomized, and peer reviewed.
Mm-hmm.
Can everything be subjected to science?
No.
Right. Therefore, how do you know this is working for you? We don't look into cause and effect, but we look into pattern differentiation. Before and after. Like you. Acupuncture, how does it work? Nobody knows.
Mm-hmm.
They can measure scientifically molecule changes
Mm-hmm.
and therefore derive these processes, but nobody's telling anybody how to do acupuncture.
Mm-hmm.
We're way far from that. Okay. But you see this before and after. You have an accelerated improvement. And especially after acupuncture that day, I think you're noticing even more improvement.
Mm-hmm.
And it's not just once. Over time, you see this pattern that's happening for you. Because acupuncture is the master switch being accessed, master switches being accessed. And so your body knows what to do with that information using your own material self.
Mm-hmm.
Okay. Plant medicine is putting in plant nutrients, so you're putting in materials to support your automatic ability to establish homeostatic state, which means no issues with health.
Mm-hmm.
When you're at a homeostatic state, everything is within normal range of functioning, not out of bound. Okay, or the idea is to go towards there. Outcome is many things do better. Your cells are more efficient with itself.
Mm-hmm.
You're made up of cells, organs, glands, immune system, nervous system. That means East Asian medicine can be used for internal medicine. Acupuncture is known for pain, inflammation, nerves. Okay, well, that's an introduction. It had the test of time and the internal issues were what we had since ancient times, and we were able to address them properly. It's a matter of how to diagnose properly and matching up. Diagnosing properly is knowing your body type, your genetic profile, because again, your genes know how to get there to that health and well-being state. It may be compromised for a variety of reasons. Let's uncompromise that compromise by putting in the plant nutrients that are not taking over your function, but help to support your function. Okay, so when you remove the plant nutrients, you're still doing better. Does that help with the logic?
Yes.
I know I said a lot there. Any thoughts, comments?
Yeah. So, if I were to try the Chinese herbs, would I then be off of the Synthroid, the medication?
Yeah.
That would be great.
The process that I prefer is.
Or do you check my genes, and how do you check that?
Right. Okay, good question. Two questions there. One is, what's the process? And the other is, how is the diagnosis done? Okay, process. You take the medication and herbs together. And you're even better than before. That leads to a question of conflict, synergistic effect. Because they talk about it. In medications, why do they talk about it so much? Because it's almost like a trauma. Maybe it's like a trauma because it could be bad when there's an adverse effect.
Right, and I think that they cause other issues when you're trying to tackle the initial issue.
Yeah, the reason why they could be so bad is because when you're doing problem focused, you're trying to isolate everything else so that it doesn't affect everything else. But that's impossible. Not one thing does one thing.
Right, the hot flashes, the inability to sleep in the middle of the night, all these things I think are tied to this.
Yeah, and the other, and so therefore you have to embrace all the effect. That's why we call it holistic. You don't want negative on one end and then positive on the other end. Give up the benefit of one thing for the benefit of another. Okay, so you want to be beneficial in multiple ways. Like when you exercise, it's beneficial in multiple ways. When you eat well, it's beneficial in multiple ways. That's how natural medicine is approached. It approaches with that big picture rather than just a snippet. Okay. And also, to be able to measure what's going on, it has to be strong. Then clearly difference here and there, and therefore FDA is going to be okay as long as the adverse effect is minimal. I know I might be saying a little negative here. I apologize.
No.
Okay, so the measurement has to be clearly strong. And if it doesn't do one thing, then it'll do another thing somewhere else, and it'll be very strong. That could be traumatic, right? And because that the medicine prevalent, which is prevalent in this society, everything else will be looked at from that lens. Okay, be careful with that. Be careful with this. It's known to be. It's like, oh, what about you? Way known to be. Okay, all right. Well, body type means is that it matches with you. As you know, some medications are good, really good, for some people. For other people with the same condition, not as good. Other people, they have to change it. That shows people have different physiology. Right?
Makes sense.
So even before you apply, you recognize how that body works. You identify it. And so then when you identify, then the body matches up better with it. That's the priority. Second priority is what it does. It's not about what it does as a priority. Oh, this herb does this. This herb does that. What does it do? It's like, yeah, but we're looking at second priority here. First priority is, does it match with you? So that in the long run, it's constructive and good. Okay. And there's talk about herb-drug interaction. Let's talk about that elephant in the room. Okay. I think it's this. It's not really about herb-drug interaction. It's about which one is going to match with you. If that drug doesn't match with you, then it will act like it's herb-drug interaction. If the herb doesn't match with you, it will act like herb drug interaction. If the herb matches with you, because it matches with you at a different level, and that medication matches with you at another level, then why should there be adverse effect? Okay, that's why you could do both together, expect even better health in 1 month period. And then when you start tapering down, you're still observing, because you want to be cautious and careful and go step at a time. Yes?
Which one are we tapering down on?
The thyroid medication.
Yes.
But it's a prescription.
Yeah.
I didn't say that. I didn't recommend that to you. Okay, it's a disclaimer, right? But it's your choice.
Well, we saw
right?
what they recommended 3 years ago, and that didn't go so well.
And then as you taper down, you're still doing well. You're still feeling good. And then later on, and then you're not taking thyroid medication. You're still taking herbs. The herb frequency is this. In the first month, take it twice a day. In the second month, it might be twice a day or once a day, depending how fast the progress is. Okay. In the third month, definitely it has to be once a day. Okay. In the fourth month, it's taken once a day for 4 days a week. Okay. And then you do the blood test and it looks good, all fine, then you're really on maintenance. Why maintenance? Because after age 35, nobody's staying that healthy state, right? Because of aging, and we start declining a little bit at a time. So we want to be optimal where we're at, because it's about balance.
Right.
Balance. If you're too much out of balance, that's called disease. A little bit out of balance, that's uncomfortable. If you're within balance, no complaint. So this disease, chronic issue. I'm not talking about emergency kind of stuff. Okay. Chronic issues and health are degree of difference. So when you're more within homeostatic state of functioning, then you're healthier. And that's what these plant nutrients do, to help you to be more at an optimal state of physiology. And that means it's longevity.
Right.
And not only health and well-being are increased, and therefore, as an outcome, you have longevity. It's a natural high. It's natural energy, because you can't give energy directly. Energy has to be an outcome of things going
it's within.
right. Right. Okay. So that's the process you treating the thyroid. And once we're done with the acupuncture, I'll start doing the examination of identifying what your body type is. Okay. So when I come back in, I will explain what that means, because how do I do the diagnosis by acting out. You'll know the process. Okay. Right. Okay. Any thoughts? Any questions so far?
No.
Okay. All right. A lot of things to think about there.